When you go to the hospital, you want to feel safe and in good hands. But now a new report has found that the number of people who have suffered some kind of harm due to errors at U.S. hospitals every year may be much higher than previously thought. According to the study published in the December issue of Journal of Patient Safety, between 210,000 and 440,000 patients who go to the hospital each year fall victim to medical errors that contribute to their death. That makes medical errors the third leading cause of death in America, second only behind heart disease and cancer.
Need a cure for those rare, embarrassing farts? Try Noose Drew It All. Clinical results say, it might work. Side effects include Tourette's syndrome,
Fart! Dildo! Big titty! Shit!
vaginal bleeding in parks, nausea and explosive diarrhea.
They also cause aneurysm, leprosy, and excruciating death.
Can you afford to go another day without saying screw it all?
If you're struggling with bipolar depression, there are treatment options. Ask your doctor if once-a-day Latuda, lurasidone HCl, may help you. In clinical studies, Latuda has been shown to be effective for many people struggling with bipolar depression. Latuda is not for everyone. Call your doctor if you have unusual changes in mood, behaviors, or thoughts of suicide. Antidepressants can increase these in children, teens, and young adults. Elderly dementia patients taking Latuda have an increased risk of death or stroke. Call your doctor if you have fever, stiff muscles, and confusion, as these may be signs of a life-threatening reaction. Or if you have uncontrollable muscle movements, as these may become permanent. High blood sugar has been reported with Latuda and medicines like it, and in some cases extreme high blood sugar can lead to coma or death. Other risks include decreases in white blood cells, which can be fatal, dizziness upon standing, seizures, increased cholesterol, weight gain, increased prolactin levels, impairment in judgment, or trouble swallowing.
Fine. Call your doctor if your depression worsens or you have unusual changes in mood, behavior, or thoughts of suicide. Antidepressants can increase these in children, teens, and young adults. Elderly dementia patients taking Abilify have an increased risk of death or stroke. Call your doctor if you have high fever, stiff muscles, and confusion on Abilify, as these may be signs of a life-threatening reaction. Or uncontrollable muscle movements, as these could become permanent. High blood sugar has been reported with Abilify and medicines like it. In some cases, extreme high blood sugar can lead to coma or death. Other risks include dizziness upon standing, decreases in white blood cells, which can be serious, seizures, impaired judgment or motor skills, or trouble swallowing.
Prestige may cause or worsen high blood pressure, high cholesterol, or glaucoma. Side effects may include nausea, dizziness, and sweating.
Elderly dementia patients taking Seroquel XR have an increased risk of death. Call your doctor if you have fever, stiff muscles, and confusion, as these may be signs of a life-threatening reaction. Or if you have uncontrollable muscle movements, as these could become permanent. High blood sugar has been reported with Seroquel XR and medicines like it, and in extreme cases can lead to coma or death. Your doctor should check for cataracts. Other risks include decreases in white blood cells, which can be fatal, seizures, increased cholesterol, weight gain, dizziness on standing, drowsiness, impaired judgment, and trouble swallowing.
Tell your doctor right away if your depression worsens, you have unusual changes in behavior, or thoughts of suicide. Antidepressants can increase these in children, teens, and young adults. Cymbalta is not approved for children under 18 risk. Severe liver problems, some fatal, were reported. Dizziness or fainting may occur upon standing. Side effects include nausea, dry mouth, and constipation.
Allergic reactions such as shortness of breath or swelling of your tongue or throat may occur and may be fatal. Driving, eating, or engaging in other activities while not fully awake without remembering the event the next day have been reported. Abnormal behaviors may include aggressiveness, agitation, hallucinations, or confusion. Alcohol or taking other medicines that make you sleepy may increase these risks. In depressed patients, worsening of depression, including risk of suicide, may occur. Intermezzo, like most sleep medicines, has some risk of dependency. Common side effects are headache, nausea, and fatigue.
Ambient CR, don't drive or operate machinery. Sleepwalking and eating or driving while not fully awake with memory loss for the event, as well as abnormal behaviors such as being more outgoing or aggressive than normal, confusion, agitation, and hallucinations may occur. Don't take it with alcohol as it may increase these behaviors. Allergic reactions such as shortness of breath, swelling of your tongue or throat may occur and in rare cases may be fatal. Side effects may include next day drowsiness, dizziness, and headache. In patients with depression, worsening of depression, including risk of suicide, may occur. If you experience any of these...
When taking Lunesta, don't drive or operate machinery until you feel fully awake. Walking, eating, driving, or engaging in other activities while asleep without remembering it the next day have been reported. Abnormal behaviors may include aggressiveness, agitation, hallucinations, or confusion. In depressed patients, worsening of depression, including risk of suicide, may occur. Alcohol may increase these risks. Allergic reactions such as tongue or throat swelling occur rarely and may be fatal.
Humira can lower your ability to fight infections, including tuberculosis. Serious, sometimes fatal infections and cancers, including lymphoma, have happened, as have blood, liver, and nervous system problems, serious allergic reactions, and new or worsening heart failure.
If you notice agitation, hostility, depression, or changes in behavior, thinking, or mood that are not typical for you, or if you develop suicidal thoughts or actions, stop taking Chantix and call your doctor right away. Talk to your doctor about any history of depression or other mental health problems, which can get worse while taking Chantix. Some people can have allergic or serious skin reactions to Chantix, some of which can be life-threatening. If you notice swelling of face, mouth, throat, or a rash, stop taking Chantix and see your doctor right away.
Daily. Side effects may include nosebleed or nasal sores, nasal fungal infection, glaucoma, or cataracts may occur.
No big deal.
Prescription Maripex may cause you to feel drowsy or fall asleep during normal activities such as driving, or to feel faint or dizzy when you stand up, or if you experience increased gambling, sexual, or other intense urges. Other side effects include nausea.
Invokana can cause important side effects, including dehydration, which may cause you to feel dizzy, faint, lightheaded, or weak, especially when you stand up. Other side effects may include kidney problems, genital yeast infections, urinary tract infections, changes in urination, high potassium in the blood, increases in cholesterol, or risk of bone fracture. Do not take Invokana if you have severe kidney problems or are on dialysis. Stop taking and call your doctor right away if you experience symptoms such as rash, swelling, or difficulty breathing or swallowing.
Twice the likelihood of foot or leg amputation. What is the FDA even for? Can a soothing voice and mellow music get you to ignore the warnings and risk life and limb? Why do you think they name most of these drugs using less commonly used letters like K, P, Q, V, W, X, Y, and Z? Is it because the names makes them appear more exotic to the customers?
And that's all I have to say about that.